That means ondansetron like drugs. These 5-HT3 receptor antagonists are also being increasingly used in post-operative nausea and vomiting. Drug of choice for post-operative nausea and vomiting are H2 blockers. D2 blockers, sorry. D2 blockers like domperidone. But 5-HT3 receptor antagonists are being increasingly used due to better adverse effect profile. Now, what are their adverse effects? So, adverse effects of 5-HT3 receptor antagonists. So, the adverse effects are headache, dizziness, and constipation. Usually, they have a good safety profile. In few patients, there may be headache, dizziness, and constipation. Now, one thing we have to remember that 5-HT3 receptor antagonists, they cause QT prolongation. So they should not be given with other drugs which cause QT prolongation, or if a patient has QT prolongation. QT prolongation is also known as torsades de pointes. Now 5-HT3 antagonist, there is a drug interaction which you have to remember. 5-HT3 antagonist, when given with SSRI, that is selective serotonin reuptake inhibitor, or serotonin norepinephrine reuptake inhibitor, SNRI, can lead to serotonin syndrome. In serotonin syndrome, there is rigidity, fever, etc. So, these drugs should not be combined together. Now, the second class of drugs is corticosteroids. Corticosteroids such as dexamethasone, and methylprednisolone, they have antiemetic properties. But exact basis of these antiemetic properties is not known. They increase the efficacy of 5-HT3 receptor antagonist, so they are add-on drug for chemotherapy induced nausea and vomiting. They also suppress inflammation. Now the third class of drug is NK1 receptor antagonist. NK stands for neurokinin. And these NK1 receptors are found in vomiting center and chemoreceptor trigger zone. So what is the mechanism of action? They block the NK1 receptor in chemoreceptor trigger zone and vomiting center and thus inhibit vomiting. What is the mechanism of action? They block NK1 receptors in vomiting center and CTZ, chemoreceptor trigger zone. Now what are the different drugs? The name of the drugs are aprepitant, fosaprepitant, netopitant, and rolapitant. Now aprepitant was the first drug discovered among this class, which is an oral drug. This aprepitant is an oral drug. Well, this fosaprepitant is a IV formulation of aprepitant. This is IV drug. Netopitant and rolapitant are oral drugs. So these two are oral drugs. Now netopitant has a half-life of 90 hours. T-half of 90 hours. While rolapitant has a half-life of 180 hours. So these are very long half-life and they are used as a single dose. These both are used as a single dose for chemotherapy-induced nausea and vomiting. So the main use of NK1 receptor antagonist is chemotherapy-induced nausea and vomiting, particularly delayed type. So they are drug of choice for delayed type of chemotherapy-induced nausea and vomiting. Now what are the adverse effects? Usually they have a good safety profile. The adverse effects are fatigue and dizziness. Now the third category of drug is antipsychotics. Now the name of antipsychotics we have already enumerated. So the phenothiazines such as prochlorperazine, chlorpromazine, they have antihistaminic and anticholinergic properties also, along with D2 blocking property. So this is the basis of their antiemetic effect. Butyrophenones such as haloperidol, droperidol, they have antiemetic properties due to dopaminergic blockade. It is D2 blockade. So this droperidol was increasingly being used for vomiting as an antiemetic, but then it was found that it causes QT prolongation and it can cause fatal ventricular tachycardias. So this drug is now used only when vomiting does not respond to other drugs. Another drug which can be used is olanzapine, and it has antiemetic properties due to D2 blockade and 5-HT3 blockade. Now the next category of drug is substituted benzamides. There, the drugs are metoclopramide and trimethobenzamide. The main mechanism of action is dopamine receptor blockade, that is D2 blockade. So D2 blockade is responsible for their antiemetic action. Also, this trimethobenzamide has weak antihistaminic property also, which contributes to antiemetic effect. Now this metoclopramide we will discuss in slight detail. So they have, metoclopramide has multiple mechanism of action. One is D2 receptor blocker. Then it is also a 5-HT4 agonist. So this D2 receptor blockade is responsible for its antiemetic effect, while 5-HT4 agonist action is responsible for its prokinetic effect. At high doses, it is also a 5-HT3 antagonist, but that effect is not seen in usual doses. So in usual doses, its antiemetic effect comes due to D2 receptor blockade. Now since it blocks D2 receptor, this metoclopramide can cross blood-brain barrier. And it can block D2 receptors in substantia nigra. So it can cause extrapyramidal side effects such as restlessness, muscular dystonia, it can cause restlessness, muscular dystonia, and drug-induced Parkinsonism. It can also block dopamine receptors in pituitary and can lead to galactoria, hyperprolactinemia. It can increase prolactin levels, which can lead to galactoria and amenorrhea. Now the next category of drug is D2 blocker or domperidone. Domperidone, which is a D2 blocker. Now domperidone has a special property. It cannot cross blood-brain barrier. So it does not cause extrapyramidal side effects. Incidence of hyperprolactinemia is also very rare. It does not cause hyperprolactinemia also. Very rarely it may cause. Now the next category of drug is anticholinergic. So in this the drug used is hyoscine, which is also known as scopolamine.